Hi, I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist. A patient recently asked me to hold their hand as they were falling asleep under anesthesia. I asked them, "Why do you want me to hold your hand?" And they said, "Doc, I want all of the positive energy you can give me as I'm falling asleep." So this will make any doctor cringe hearing energy medicine, like the most controversial thing an MD can possibly talk about, and we're gonna talk about it. What is energy medicine and how does it work? And what did I do for this patient when they asked for me to impart my energy onto them? Medicine's greatest secret is our inner healing potential, and it's most powerful under anesthesia, when we let go of the reality we think we know. Energy medicine is probably the most controversial part of our Western medical system because we can't measure this invisible healing field. We have no proof that this invisible field really exists. And as you know, if we can't measure it in Western medicine, we get really afraid to talk about it with patients. And I'm really sorry about this because it would probably help so many patients if we were open and honest about the limitations of our knowledge and the potential benefits that this knowledge could bring them. Simply put, the Western biomedical model is severely limited. It sucks for things that we can't tangibly touch. And as subjective as energy medicine may be, you know what else is really subjective that causes my patients a lot of suffering? Depression, chronic pain, chest pain before a heart attack. The list goes on and on. In fact, nearly all conditions will start off in a subjective way that we can't measure as of yet in the Western medical model. All over the world, energy is the foundation of all medical models. In the West, we focus at the cellular level, at the ATP generated in the mitochondria of every cell as the energy that fuels all cellular processes that affect the rest of the body. In traditional Chinese medicine, they call it qi, what we loosely translate as energy, QI. In traditional Indian medicine called Ayurvedic medicine, they call this prana, literally means breath. In Greek, they call it pneumo, also referring to the breath. And Franz Mesmer, where the term mesmerism comes from, called this animal magnetism. They all focus on the same concept, which is our health is like a spinning gyroscope. It's spinning on its axis, and things in life invariably pop it over on its side. In a healthy, energy-flowing body, that gyroscope can go back on its axis. This is actually really relevant to surgery because surgery is a total physical and psychological trauma that can throw people off their kilter. But with the right energy flow, presumably, they can come back online to ultimately help heal themselves in their recovery after surgery. It's all about this concept of balance, what we call homeostasis in the Western medical model. The body wants to heal itself. Like when you go under anesthesia, your blood vessels dilate, your blood pressure drops, and your body increases its heart rate to compensate. It's like the gyroscope gets pushed over by the anesthesia, and the body will correct itself to maintain blood perfusion to all of your vital organs. We give it fancy names in the Western model, like sympathetic tone, but it might reflect this same energy model construct. Acupuncture, pranayama, qigong, tai chi, reiki, and maybe even EMDR to some extent all capitalize on the same concept of restoring energy flow, maybe adding energy to the system if it's deficient, to help the body restore its balance and ultimately heal itself. The areas in the body where the energy lives are called chakras in Ayurvedic medicine and dantian in traditional Chinese medicine. And all of this energy medicine ultimately pokes at the concept of consciousness, which I manipulate all the time in the operating room or in my ketamine infusion clinic. Because consciousness is also super important, but we can't measure it yet. And we don't know if our consciousness is a result of our brain chemistry or if it's something independent altogether that affects our brain neurochemistry. You can see why doctors are afraid to talk about this with patients, right? But just because we don't understand how it works doesn't mean we shouldn't be inviting the conversation or supporting patients that are interested in learning more about it if there's no demonstrable harm. Like, when was the last time you went to a surgeon who offered surgery but didn't want to offer the general anesthesia because we don't understand how anesthesia works? Yeah, we really don't know how anesthesia works, but we use it every day. Maybe energy medicine works on the cellular level where ions and charged molecules are moving across barriers in the body, generating electrical fields and magnetic fields. Or maybe it's because of quantum effects like resonances and vibrations at a cellular level. I really don't understand, and I don't have to care that much because I still use anesthesia every day. I don't know how it works. And I use my cell phone every day, which manipulates all sorts of quantum principles that I don't understand either. If it helps patients and it doesn't harm them, and there isn't any appreciable cost associated with it, why aren't we talking about this more? There is this beautiful construct in traditional Chinese medicine. It says that our mind or our intentionality directs our qi, our energy, and our blood follows the qi, or our blood follows the energy. So it's saying that our intentionality directs our energy, and our blood follows that energy. It's similar to the trickle-down effect that we all know about in yoga, which is from Ayurveda or Indian medicine, where the energy that we are building up in our consciousness trickles down to the rest of our physical body, ultimately. But we totally ignore the mindset component in our Western medical model. And this has huge implications when our patients need that mindset push the most, like before surgery or before a psychedelic experience. If you want some real examples that poke at this sense of energy, ask yourself, have you ever felt a lump in your throat? Have you ever felt turned on? Have you ever felt your stomach turning over or felt butterflies in your stomach? Have you ever listened to a recording for ASMR? Have you ever felt a heartwarming experience or cathartic crying or felt a light bulb go off in your brain? These are all examples of things that we can't measure very well, but they're definitely sensations that my patients experience before surgery, after a psychedelic trip, or at any other points in their lives. We know these are real sensations, but we really don't know where they come from. And there are some similarities with things like phantom limb pain, complex regional pain syndrome, fibromyalgia or myofascial pain, nausea, chronic pain. Are you surprised that acupuncture, which can manipulate the energy flows, or psychedelic medicine, which can fundamentally alter our consciousness, can be so powerful in treating depression, anxiety, chemotherapy-related nausea or vomiting, chronic pain, and potentially many other conditions that we still, as of yet, can't measure? Energy medicine is by no means a silver bullet. Very few things in medicine ever are. But is energy medicine a powerful construct that we can integrate with the care that we're already delivering to patients? Absolutely. If we can harness this energy for good, say before surgery or before a psychedelic experience, we can relieve anxieties, fears, and doubts rather than fueling them by ridiculing patients or by blowing off something that they might want to talk about. And at the end of the day, for my surgical patients, this can reduce anesthesia doses. It can reduce the risk of surgical site infections or blood clots, or reduce the chance of acute pain transforming into chronic pain. And it can even make recovery times faster. So what did I do with my patient who looked me in the eye and asked me to hold their hand as they were falling asleep? Not only did I hold their hand, I asked everybody in the room, the surgeon, the nurses, the scrub tech, to hold on to their hand and their shins as they fell asleep, as calmly and as relaxed and as compassionately as possible. And they woke up with that same level of calmness and serenity that I see in my patients that meditate a lot and that seem to have some appreciation for harnessing their energy for their inner healing potential.